Welcome to online lectures with Pharmacology, the schoolboy. Today, we'll continue from where we stopped at the routes of drug administration. We are going into the classifications of routes of drug administration. So, routes of drug administrations are broadly classified into two: the enteral routes and the parenteral routes. The enteral routes and the parenteral routes. Okay, now let's go over to the enteral routes. Enteral route of drug administration. When you talk about enteral, anytime you hear the word enteral start from here to the anus, that gut from the mouth, that gut, that pipe, that gut that has two openings, one here and one at the anus. That two opening, that tube, it refers to as enteral. So anything that happens in that tube is enteral. That's the most important thing. Anything that happens in that tube is enteral. Then parenteral, 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 parenteral. When you hear the word parenteral, it talks about around the gut, around it. It's not within it, around. So any other thing, any other source through which drug can enter the system apart from this gut is called what? Parenteral. Parenteral. Now let's go over to the enteral. What do you understand? What are the drugs under this? What are the routes under this enteral? The main routes under this enteral are the oral, sublingual, rectal. Oral, sublingual, rectal. Oral, sublingual, rectal. We also have buccal anyway. Oral, buccal, rectal, sublingual. We'll take them one after the other. Then when we talk of parenteral, there are different routes under parenteral. Under parenteral, you start having the intravenous routes, intramuscular routes, subcutaneous routes. You start having intramuscular route, intrathecal route, intraarticular route, inhalational, intranasal, topical route, ocular routes, optic route, transdermal, very transdermal patches. There are many of them. So having listed them, we'll take them one after the other. So let's start from the oral route. Oral route. Oral route is the commonest and is the oldest. Oral route is the commonest and is the oldest. What are the advantages of this oral route? Number one is that it is safe. The oral route is safe and is convenient. The drug does not, the patient can self-administer. He doesn't need any special technique to administer it, even though yes, there are best ways to swallow tablet. That's a topic for another day. But this is what the patient can do. Remember, it is safe, it is convenient, and the administration doesn't necessarily need an assistant, and it's non-invasive. You don't need to inject or do anything that suggests invasion. So that is not invasive. It's not invasive, and it's painless. It's painless. The drug does not, the medicine does not need to be sterile. Does not need to be what? Sterile. And it's less expensive. It's cost effective. It's cost what? Effective. It's cost what? Effective. So what are the possible limitations of these oral routes? So medicine medicine that are administered through oral routes, they are should they have shown slower drug action, onset of action. So if you want the immediate action of the drug, you don't need oral routes. It shows slower action of what? Onset of action of drug. And because of that, it's not suitable for emergency situation. I think I mentioned that. Some drugs that have some drugs that are not palatable, some drugs that are that don't have palatable tests, uh, it may be difficult to administer such drug through the what? Oral route. So that's why you see for doing the formulation, they will put sweeteners, they will put flavoring agents just to make it palatable. The end is to improve patient compliance. Okay, okay. The another thing there is that it can cause vomiting and nausea and vomiting. Yes, because of there are some drugs that once even the odor alone the test can make the patient to vomit. So it's a limitation. Because of that, some patient may not want to take drug through what? Oral route. So it's a limitation. It's a limitation. For a patient that is vomiting already, patient that is unconscious, and the patient that just doesn't want to take medicine, giving the patient may not be able to, you know, take drug, take medicine through the what? The oral route. It may be very difficult for the patient to do that. Even if you give the patient you dispense the medicine and patient takes the medicine home, he will throw it away. He or she will throw it away. So you can see that for uncooperative patients, the patient that is vomiting, oral route is not the best. So it's a limitation. The same way for patient that cannot that for a patient that is unconscious, so oral route is not the best for such patient. Okay. And also another limitation is that absorption from this oral route is erratic and variable. Is erratic, is variable. So what are examples of medicines or dosage forms that can be administered through this oral route? You see dosage forms like solid dosage form like powders, tablets, capsules, granules. These are solid dosage forms that can be administered through the oral route. Another one is liquid. Under liquid, there are many of them. We have elixir, syrup, lactoses, mixtures, emulsions. There are many of them that can be administered orally. So this is the much you can take under oral route of drug administration. Now let's go over to I will take sublingual and buccal together, even though they are not exactly the same, but I will just explain them together. Um, when you say sublingual administration is just where it's a situation whereby you place the medicine beneath the tongue, and hold it firm, allow it to do what dissolve there. Once it dissolve, the drug inside the medicine will be absorbed directly into the vessels, into the small blood vessels there, right into the circulation. They don't get down to the stomach. They don't get down to what? The stomach to cause issues or to get destroyed. So that is what happens in sublingual route. Then buccal route. In the buccal route, the medicine is placed in between the cheek, and the gum. In between the cheek and the gum. The same thing happens there also. They dissolve and get absorbed directly into the small vessels. From there, they get into the what? the systemic circulation. So that's what happens in sublingual and buccal. That's what happens in what? Sublingual and buccal. Okay. Now, now, I think I've mentioned that these things are important to avoid destruction of the drug. Yes. In all that, what the target is to run away from the what? What happens in the what? The stomach. Mainly good. But this that is advantage. Yes. There are advantages of these buccal and oral, buccal and what? Sublingual. They avoid what? Destruction in the what? By gastric juice. Now, but another thing, one another issue there is that drugs that are bitter preparations are not suitable for this type of what? Route of what? Administration. Bitter preparation, because the patient cannot hold it in the tongue for a long time. And the patient cannot hold it at all because it's bitter. So medicine that are bitter preparation is not ideal for this route of drug administration. But a very important aspect is that drug that can be destroyed by the gastric juice, it's good to use them through sublingual, to administer them through sublingual or buccal. Also, if you want, also if there are some oral, some normal, some medicine drug that can be not should be normally swallowed and get to the stomach before action. Normal, they should do that, but you want immediate action, but you don't want to go through the injections through the intravenous route or intramuscular route. You can actually use sublingual or buccal, because when they dissolve, they absorb into the what? Into the what? The systemic circulation. It's also an advantage. Okay, good, let's continue. So examples of drugs that are administered through sublingual and buccal. Example, we have here, very popular one, nitroglycerin, glyceryl trinitrate, very, very popular. Hypertensive patients use it. Very, very popular. The next one is what? Buprenorphine. So we have nitroglycerin or glyceryl nitrate and the buprenorphine. There are many of them, but I just pick these two. This can be administered through the what? Sublingual and buccal route. Now let's go over to the rectal route. Rectal route. What happens in the rectal route? What happens in the rectal route? Good. From the from the word rectal, you're talking about the word the rectum. Rectum. So here, the same thing that happens in the sublingual and buccal. The drugs are formulated in form of suppository so that they can be inserted in the rectum. But let's go a bit pharmaceutical. If you go into pharmaceutical formulation of this suppository, please, if you want to know about suppository, please watch my lectures on suppositories. Go to my YouTube channel, Pharmacology the Schoolboy TV. Search for my lectures on suppository. Go to the playlist, look for dispensing. Go down to dispensing, you see different lectures on suppositories. Then you study it, watch the video, you understand what suppositories are all about. So basically, suppository, the suppository in suppository, the drug is incorporated in a fatty base that when to form a solid dosage form with other ingredient excipients, when inserted into the through the anus to the rectum, when you get there, they will melt at the body temperature to release the drug. This drug that it will release will now be absorbed through the vessels in the rectum and enter the systemic circulation for those that intended for systemic action. Locally, there are those that are intended to locally to take care of the ailment at that anal region, things like hemorrhoids or pile. But things like constipation and other and in some psychotic patients, they use suppository for systemic effect. So let us not go too far. So this is basically what happened in what in the rectal what administration. So what drugs, nature of drug should be administered through this rectal route. So there are some drugs that cannot be taken orally because they are not palatable and they are irritable. So they cannot be taken what orally. So maybe the patient also is unconscious. Yes, if the patient is unconscious, yes, and also if the patient is how do I put it? If the patient if the patient have some restrictions in eating, maybe prior to surgical operation or post-surgical, he restricted to eating, but he needs that particular drug, it can be administered through the rectal route. Yeah, because there are some surgical procedure that patient don't need to eat anything, and the drug you are taking pass through the stomach. So no need give you oral, they can insert it. So that's exactly what happens. Okay. Uh, some examples of drug that can be formulated as suppository for rectal use. We have drugs like paracetamol for fever. That one is popular. Drugs for seizures like diazepam is also there. For constipation, I think I mentioned constipation. Something like um, mm, um, something like um, the brand name is Ducolax. The popular brand name is Ducolax. The popular brand name is Ducolax. That is Bisacodil. Bisacodil. There are many of them. We have your Anosol for hemorrhoids and pile for hemorrhoids and pile. This one is local. It's localized. The action is for local effect. All right, let's continue. So this we have actually pointed out, say one or two things on the drugs on the enteral routes of drug what administration. Enteral routes of drug what administration. Enteral routes of drug administration. Enteral route of drug administration. Okay, so in our next class, we'll continue from the parenteral routes of drug administration. We have already listed the parenteral routes. In the next class, that's what we dwell on. Parenteral routes of drug administration. Please, for more lectures, subscribe to my YouTube channel by clicking on the red button if you're on YouTube. And that red button is written subscribe. Once you click it, click on the bell like button by the side so that each time we post a new lecture, you'll be among those that are among the first to watch the lectures. Also follow me on Facebook. My Facebook name is Farmetante the Schoolboy. My Facebook name and my YouTube name, they share the same name, Farmetante the Schoolboy TV. Please share these lectures. Ask if you have any question, drop it on the comment section and I'll attend to it. If it requires making another video, I'll make another video to explain. And God will bless you as you do so. See you next time.